but we begin this hour with a popular weight loss drug getting a big price cut. Eli Lilly says it's now selling one-dose vials of Zepbound, which is a 4-week supply for roughly half the usual monthly list price. The drug can cost more than $1,000 for that amount. CBS News medical contributor Dr. Celine Gounder is back with us. She's also editor-at-large for public health at KFF. Good morning to you. So, one, what is the actual cost of Zepbound, and why is this so important?
So the Zepbound that you can now get through Lilly Direct, so directly from the company, is about half price compared to what the list price is. So for the lowest dose, about $400, and for the next dose above that, for about $550 a month.
So Lilly Direct, is this like a pioneering new direct-to-consumer thing, or is this something a lot of companies do?
This is a new move by pharmaceutical companies to sell prescription medication directly to consumers. Now, you still do need a prescription from a clinician, doctor, or other kind of clinician, for an FDA-approved indication in order to fill a prescription. But it is a new move to directly market, to directly sell to consumers.
And cut out the middleman, I presume?
That is right. That is right.
Okay, so you said you need a prescription from your doctor. That's how someone gets access to it. But how soon will it be available?
Well, now that you have Lilly Direct set up, they are working with other companies like Amazon Pharmacy and Dokoupil to fill those prescriptions and ship it out to you. But that is something that is available even now, and that physicians can start to send prescriptions to.
So the compound drug market, right? These are these cheaper mixtures you can get online. How does this direct-to-consumer move affect that market?
Well, the reason we've seen these compounding pharmacies selling basically knockoffs of medications like Wegovy or Mounjaro or Zepbound is because there's a loophole created by shortages of medications where the FDA allows for compounding pharmacies to fill that gap.
Wow.
Now you have Novo and Lilly saying, oh, no, those shortages don't exist anymore. Now the FDA has to certify that is true. But assuming that is true, then there's going to be a crackdown on some of those compounding pharmacies like Hims and Hers and so on that you see online where you can order these medications from. And what you're seeing here with Lilly Direct is they're going to be filling that gap. So we know that the price that they're selling these medications for is about what consumers have already gotten used to with those online pharmacies.
But I was just going to say it's going to open up supply to the point where now folks won't have all those delays in getting their medications.
Yeah.
I mean, theoretically, Lilly and Novo will have adequate supply, but that remains to be seen.
So the popularity of these drugs has risen because of the weight loss effects. But when you hear these conversations coming up in public, there's always one person that jumps in and say, wait, we don't know what the side effects are. We don't have enough research on what's going to happen later. So what do we know now, and what are some possible side effects down the line?
Well, a lot of people experience nausea. In fact, many people discontinue taking these medications because the side effects do become so difficult to live with day to day. So that's something that's important for people to be aware of. We don't know what this could mean in terms of long-term risk of cancer, for example. These are medications you take every day. And remember, people were so worried about a one-time shot with a vaccine and what were going to be the long-term consequences of that. This is something you take every day for years. Yeah. And so we don't have that kind of follow-up data.
Wow. All right, Dr. Celine Gounder, thank you very much.